Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Synthetic luteinizing hormone and follicle stimulating hormone. Synthetic luteinizing hormone and follicle stimulating hormone. Human menopausal gonadotropin is derived from the urine of postmenopausal females. Human menopausal gonadotropin has 75 international units of luteinizing hormone and follicle stimulating hormone. It is used for ovulation induction. Chances of multiple pregnancy in human menopausal gonadotropin is 30%, and chances of ovarian hyperstimulation syndrome with human menopausal gonadotropin is 5 to 15%. Recombinant follicular stimulating hormone. Recombinant follicular stimulating hormone is more effective and expensive than human menopausal gonadotropin.
thank you and thank you for watching.